Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Right. Renal cysts. We have benign renal cysts. The most common renal cysts are most commonly we have benign renal cysts. These benign renal cysts are present in more than 70% of these benign renal cysts are asymptomatic. And these benign renal cysts are mainly present in men. These are more common in men. These benign renal cysts can be solitary or they can be multiple. They are more common in men. They are either solitary or multiple. Then prevalence of this benign renal cysts slowly increases in age, and they are seen in more than 50% of these benign renal cysts are seen in more than 50 years of age. More than 50% of patients are of more than 50 years of age. Benign renal cysts are mainly treated by doing a percutaneous drainage, and sclerosis can be done with 95% alcohol. That means if this is the cyst, you will have to do first, you should introduce a catheter and you will drain the secretions present in the cyst through this catheter. So if you drain the secretions present in this cyst through the catheter, you will drain it, and followed by you will inject the alcohol is injected into the cyst, so that the alcohol will remove if there is any infectious agent or anything, and thus it will prevent the recurrence.
thank you and thank you for watching.